Dr. Joseph Laratta from the Neck and Back Institute of Kentucky. And today I'd like to tell you a little story about a patient who's very special to us in our practice. This is a patient who suffered a high energy fall about 3 weeks before meeting us. He was admitted to an outside hospital in a relatively rural area. And the doctors at that facility recognized they were unable to treat him. I received a call from one of the pulmonologists or the intensive care doctors. He was extremely concerned about the patient's condition because he couldn't move his legs. And he asked me, "Dr. Laratta, would you accept the patient?" I immediately had the patient transferred to one of our facilities in which we operate. He had bacteria flowing throughout his entire body and he was floridly septic. He was unable to move his legs.
Was laying there in the hospital. They were telling me that I probably wouldn't walk again. They told my wife I probably wouldn't walk again. That if I did, I'd be totally messed up.
The patient was diagnosed with multiple conditions of the spine, all of which were life-threatening and serious.
Their prognosis was not gleeful by a long shot. But I remember coming into semi-reality from wherever the hell I was before. I was everywhere before. But I remember one of the first things I told my wife when I told her I'll be walking by Christmas. I had people tell me, "Nah, it ain't gonna happen." When I first went to therapy, they told me, "No, not at least for about 2 years of extensive therapy before you will walk."
He had a 3-column unstable fracture of his spine at the level of his thoracic spinal cord. A 3-column fracture means it's fractured both in the front, in the middle, and in the posterior columns. And that's an extremely unstable fracture. In addition, he had osteomyelitis discitis, which is infection of the disc and the bone in the thoracic spine. Except at this level, the infection was actually flowing around the spinal cord, wrapping around it, causing constriction and causing him not to be able to move his legs. We performed 4 different surgeries on this gentleman. A surgery through the front of the neck, through the back of the neck, a surgery through the chest cavity, and then a surgery through the back of the thoracolumbar spine. We took all of the infection out of his spine. We took all of the pressure off of his spinal cord.
I have no idea. I don't want to find out. I don't want to have to compare notes, be able to compare notes. But I personally don't feel that if I would have gone to another physician type person to operate from, I've been around 61 years. I've seen a lot of people that have had, I got friends that are still in wheelchairs, and I don't think I would have, I may be biased, okay? But I don't feel that if I would have been under somebody else's knife and expertise, that I would be walking today.
Here at the Neck and Back Institute of Kentucky, we are extremely fortunate to have Ivy League trained surgeons who are both orthopedically and neurosurgically trained in spine surgery and have the ability to perform the most complex spine surgery procedures. But even when we do those things, and we do them perfectly, sometimes patients don't improve. In this case, there was someone that was looking over his shoulder. This patient had a miraculous recovery. He recovered all of his neurologic function entirely, and he was able to resume all the activities of daily living and the activities that he enjoyed doing.
I walk, I go get groceries, I live a semi-normal life. Yeah, I got my moments, I got my pay, I cook, but I gotta sit down for a few minutes and get up and go do it again. Today I cleaned and I did dishes, and if it wasn't for the expertise of Dr. Laratta and people in that, the guy's good at what he does, okay? There can't be very many people out there. I don't know. I don't want to get to a point I can compare notes, okay? But the guy's good at what he does. The guy is I don't feel that if I'd been under much anybody else's knife that I would be where I'm at today. And I owe him such gratitude. My wife expresses her gratitude for what he's done. And good job, dude.
We were extremely happy with how his surgeries had went, and even more happy with how he recovered. Not every patient has a miraculous recovery like this patient. However, we do our best to treat each patient individually with expert surgical care. If we continue to do that, then most of our patients will do well. The vast majority of our practice is referrals from other surgeons who recognize the patients need surgery but don't feel comfortable doing it. It is our pleasure and our goal to take care of those patients who would otherwise be lost.